And we are live. Welcome, everyone. Welcome to the next episode of DeSci Pulse. Today, we're bringing you the seventh episode of the DeSci podcast, where we discuss weekly the news from biotech and DeSci together with other founders from the sphere. Today, I'm joined here by Wellfare's co-founder and CEO. Also, a person that has a background previously in big pharma, Jock Schulz. Hey, Jock, thanks for joining us today.
Hi, Oliver. Thanks for having me.
No problem. So, before we actually dive into talking about what Welshare Health does, how they actually fit into DeSci and what they're trying to change, what is the problem that they're tackling, I just like to take a minute to discuss the news from the DeSci that kind of actually struck the space during the last week. I'm sure, Jörg, that you have noticed. Most of us have noticed, and the ones that didn't, they surely noticed that the market, was literally rocket fueled. And the reason for that is that actually Bioprotocol and Binance Labs Fund have revealed an investment in Bioprotocol, which, after having A16Z also invest in AminoChain a few weeks ago, this is a clear sign that there's capital flowing into DeSci, and I personally think that this is a good step, seeing that there is an investment adoption towards more of a utility token, although this has been kind of washed the day after by Binance listing a meme coin with a 20 million market cap valuation. But we have to start somewhere, and we already see the big players flowing into DeSci, which I believe is a great news. The other one that I have is actually a pretty fresh one. It's the one that came out 5 minutes ago. So, Jörg, I'm sure that you haven't noticed, but we have just announced actually a collaboration with one of the biggest epidiagnostic and wellness, epigenetic and wellness diagnostics laboratories in the UK. They're called Moodoo, and they're actually trying to bring their customers closer to Web3, and they decided to partner with us and use us as the consent protocol. You can read more about that on the Twitter post that we have posted in the article. And I don't want to shill no more, so without further ado, Jock, if you could give us a little round of introduction about what is your background, what is Welshare Health, for the ones hearing the name of yours and the companies for the first time, so they would kind of, understand from the bird's eye perspective what you guys do.
Sure, definitely. First of all, let me say congratulations. This partnership sounds very exciting. You are correct that I haven't seen it yet, so I'm very interested in hearing more about that. So feel free to keep on chilling within this conversation or after. Also on the note, in terms of Binance's investment in Bio, I think this is great news for the space. It's probably like one of the key catalysts. Having these big names. Being onboarded into DeSci, not just from a branding perspective, but because it gives the space the credibility that it deserves, and at the same time, it also shows that the DeSci industry as a whole is on the right track, right? So I think every one of these milestones, any one of these metrics that we can show and showcase to the broader Web3 audiences, but really the wider world for that matter. It's really great for the entire space. So yeah, congratulations to you on your partnership, but then also, of course, to Bio on that very amazing milestone.
Big kudos to the Bio. I didn't expect it. I didn't know it. We're pretty close in the DeSci space, all talking to each other, but I didn't know. I didn't have a single clue about this happening. But this is really bullish, and now it's not the question about who's going to invest next in terms of the investment, but who's going to be the next project that's gonna receive such support. So I'm really looking forward to even bigger adoption by the VCs.
Exactly. Yeah, but to your question, around my background and what we're doing at Welshare. So I've been working in the healthcare space for the past or more than a decade by now. Started out my career in the pharmaceutical manufacturing space back in the day. Feels like an eternity ago, but I did study chemical engineering at one point. Took my first job in the manufacturing space of pharmaceutical ingredients as a plant engineer. Then kind of shifted gears a little bit because at that time I was interested not only like how do you set up the manufacturing processes, but also purely from like a scientific perspective when it comes to pharmaceutical manufacturing. Like why would you do for example a crystallization process step as opposed to like any other separation process? So really from like a process engineering perspective, was interested in that more. Went back to university, did my master's also in chemical engineering with a focus on pharmaceutical engineering. Wrote my thesis on essentially how to make poorly soluble drugs more soluble, so that when you do consume them, for example in an oral format, that when they enter your body, they're absorbed quicker into your membrane, and then you can do all the things that it's designed to do. Did that, and at the end of that thesis was politely declined the offer of the professor to continue working in his lab as a PhD candidate, mainly because at the time I was interested in business topics, particularly around M&A, corporate finance, accounting, but at the same time also I couldn't see myself working in the lab as a PhD student for the next 3 to 4 years. And which is why whenever I meet, and as you know, like the DeSci space is full of them, but whenever I do meet PhDs, I have to commend them for their patience, really, to go through with it. I think everyone who knows me knows I'm a very impatient person, so that was off the table. But what I decided to do instead was to get my MBA and go into life science consulting. So did that at the end of my MBA, did another thesis paper on essentially comparing the M&A strategies of two top pharma companies, Novartis and Roche, who I thought were super interesting because they're both situated in the small town in Switzerland called Basel, and they do have like fairly different M&A strategies and corporate portfolio strategies for that matter. But I always thought it was interesting because they're both super successful and they have that proximity. So that was interesting. And after that, I joined a life science consulting firm, did strategy consulting for big pharma and medtech companies, everything from like portfolio optimization strategies to like production sites and logistics to M&A advisory as well. So a lot of the strategic decision making that goes on in that space for those big clients, which was great because it at a fairly young age was able to really network with these C-level and like N-1, N-2 kind of people in these very large organizations. So I think that was very nice. But as many people are aware, in consulting, work-life balance isn't the best, and I wasn't looking for another job. I was like just kind of interested to see what was going on, what other things were going on in the space. And the projects I was doing in consulting were more and more digital health. And at that point, I just realized, there's so much untapped potential in the digital health space. So, I mean, we see these disruptions, the Airbnbs, the Ubers of this world. We see all these disruptions in other industries. But healthcare, yes, of course, there's new medications and there's new innovations all the time. But like these true disruptive ones, it's much rarer and a lot slower than other industries. So as I was just kind of had an open mind, connected with someone at a top 10 pharma company called Sanofi. Ended up taking a job there.
The viewers, they really know well Sanofi because they're actually becoming quite a prominent figure in AI and also in blockchain lately. They're one company I believe is I don't want to say pioneers because I don't really have the full landscape context, but I know that Sanofi has been actively researching how to leverage this tech. So it's quite interesting that he went from Sanofi all the way to blockchain. But sorry for interrupting you there.
Yeah, no, absolutely. And I know you, by the way, I know you guys also have a partnership with Sanofi. So it just goes to show that, not only this company, but just generally like these big, giant corporations are, of course there's going to be some that are kind of have that traditional mindset and are going to try to do the minimum as it pertains to true disruptive innovation and change, just because it's comfortable to continue doing what you're used to doing for the past centuries or decades at least. But yeah, I mean, you're absolutely right. Like from a public standpoint, like it's very obvious that Sanofi keeps on announcing that they're very interested in AI, and our AI is like a very integral part of their strategy, as well as some other Web3 components. So yeah, it's great to see. But like I said, I get I get bored easily. So as I was getting more into the Web3 scene, and actually I met my co-founder at the very first DeSci Berlin conference back about 2.5 years ago. That was really like the moment for me where I realized, what, I'm not the only one who sees this vision, who's thinking about how to merge these two worlds. And how to really leverage Web3 for the benefits of patients. And I think DeSci Berlin 2022 was just a really inspiring moment, because for the first time I was in a room with hundreds of people who were like-minded, and just like, yes, this, and not only were they thinking it, but they were already acting on it and building. So that was amazing. But yeah, so eventually that journey got me into leaving the company and founding Welshare together with Murad, my co-founder. And yeah, so we've been building ever since. For those who are not aware of what we're doing, so Welshare is building a decentralized application for people to share their health information and to be able to contribute that to medical research. So I think it's really interesting, and we've talked in the past, obviously, around like the synergies together with Data Lake and the shared passion for the space. I'll give it a little bit more context, and then maybe I'll let you ask the questions which direction you want to take this. But for a little bit more context, so there's an app for individual users to essentially upload their health information. So right now we're in the closed beta testing with the first 100 diabetes patients. We'll be opening up the second version of our closed beta here in the near future. And registrations are currently open for those who want to apply. But yeah, so essentially what the current version does is when you register for the app, you get to fill out a medical questionnaire, very basic questions that you're familiar with going to the doctor's office, around current health status, any allergies you might have, maybe any medications you take, and so on. And then the idea is to insert daily information about your health status. So since we're starting in the diabetes space, the first thing that we're measuring is blood glucose levels. The current version has manual entry fields, which are still pretty basic, but I think a great starting point. So you enter in your blood glucose level in the morning, and then when you're fasted, and then 2 hours after the first meal. We're also very excited to announce that our devs were doing very, very hard work, and now found a way actually to integrate the very first CGM device, so continuous glucose monitoring.
The Abbott, right?
Abbott, yeah.
I've seen the news a few days ago.
Yeah.
That's amazing. I personally, I use Abbott sometimes, just to measure my glucose, and I tried hacking it unsuccessfully, so I understand how hard and challenging it had to be.
Yeah, exactly. Yeah, we're very pleased with it. So yeah, that's ongoing development. But yeah, I think we found out how to do it. But yeah, I mean, like the gist of it is you're able to connect it with your CGM device. That way, like all of the data, if you agree to, is transferred automatically in the back end without you actually having to worry about it. And then for sharing that data, you earn in-app reward points. These points we call sharies. and these shares then you can later on convert into fiat or crypto. As we're in the diabetes space for now, with our main focus, we understand that most diabetes patients don't know or understand what Web3 is or how it works. So all of the relevant Web3 components as it pertains to the tech stack are currently abstracted into the backend. So for example, you can register just purely with your email address, and the wallet is created in the backend for you. Soon we'll also be integrating wallet connection functions so that for the people among us who do understand how wallets work, we can then log in just using our wallet. And then in addition to the app, what we also have, what we're currently building out is the B2B platform. So essentially any research organization that is interested in this type of data can then log into and not only view the data, but then also, we have several different components to it as it pertains to clinical trial recruitment and other functionalities around patient monitoring. And just super excited to be building in the space, something I'm very passionate about, and just really, really happy to be here, to be honest. And one other thing, just on that note, we've talked about this in the past, but I just wanted to say thank you for creating and hosting this podcast, because I think it's clear that there's so much value in the entire DeSci industry and with all these different projects, that I think the one missing component, and I've said this many times before, but I'll say it again, the one missing component really is just awareness. When we're out at you're in Bangkok right now, I think, when you're at these conferences talking to people who've never heard about DeSci, I think it's quite clear that the reaction is like this light bulb moment where it's like, oh yeah, why didn't we do that before? Like, how could we? Why would the Web 2 world in healthcare even be like that? So
you should have seen the DeSci corner today that we had actually here at DevCon Bangkok. Whereas most of the people didn't have a clue what DeSci is. We also had some prominent guests. Vitalik stopped by.
I saw that. That's nice.
But most of people really didn't know about this sphere. So awareness is something we're missing, and talking to people individually on conferences is kind of hard, to spread the awareness. So I think that this is the smallest thing that we can do, right? Anyway, thank you for the introduction. We founders are usually humble, so you perhaps wouldn't say it's an inspiring story, but someone else might. I personally believe that it is. You've seen the side of the business, you've seen side of the chemical engineering, so more of the medical side. So you're like the perfect combination to become like a science founder, or at least a founder. You have the hands-on experience, which I believe brings a big value. But I just really want to circle a little bit back to actually the problem. So you told me, how Welshare solves this thing of, enabling users right now with the diabetic diagnosis to share their data without having to care about anything, that you handle it on the back end. Which, by the way, is great, this is what I support, this is the adoption that we actually need of using the blockchain without, having all this hassle connected with using the blockchain. And this is kind of the philosophy that we also follow. So, right now we have something very similar when you're signing in, giving a consent or even publishing a research project. You don't really know what's happening under the hood, because to drive a car, right, you don't need to know how engines work. And I believe that this is actually a prime example of that. But circling back from the solution to the problem, I'd love to ask you about what's actually the problem you guys are aiming to solve in the healthcare sector. Like, who actually needs this diabetes data, right? Because people might think like, what you gonna do with it, right? What are the next steps? What we can do with it? What's the vision?
Yeah, absolutely. Very important question. So I'll give you the general answer, and then we could dive into a specific use case. So the general answer is essentially all of research needs data. Especially as we move into more and more of AI-based research, the AI algorithm is really dependent on the quality of the data. So the better the data and the more holistic the data set and the more diverse it is, the better the system, and in this case the AI, is going to function. There's a couple different problems. So like from from the research side, like if you're a pharma company, for example, there's as you guys know this, of course, but like clinical trial recruiting isn't always easy. Finding the right people for the right time isn't always easy. It's very costly. Depending on the drug and the therapeutic area, it can be millions of lost revenue every day for not being able to recruit into clinical trial study. But it goes beyond that also. Like anything that has to do with patient behavior insights. So just like a general example would be, a pharma company has really no understanding of their of their end consumer, right? And in the Web 2 world, this is a good thing, right? Because as a patient, I don't want the pharma company to know like the details about my life and
you don't
what's
want to
working.
know who you are, what's your diagnosis. You want to limit the
Exactly.
tracking, not only by
Exactly.
pharma but anyone, to the minimums.
Exactly. And so in this Web 2 world, like the way things are constructed makes sense for that Web 2 application, but it also at the same time hinders more innovation, because without truly understanding what's going on in the patient's life, it's hard to understand certain nuances. So like for example, if I'm not taking my medication, why is that? Is it because I forgot to go to the pharmacy, or maybe I don't have a card to go to the pharmacy and the public transport isn't working, or maybe I'm sick but I have a partner who's even more sick than me, so I kind of forget about taking care of myself. So there's so many different nuances to I use the term patients, but like I think a better term really is just like individual human beings, because that's what we are. And whatever's going on in our lives, like if we feel good, if we feel bad, if we're sick one day, if we're sick continuously, at the end of the day we're still human beings, and there's so many different things, there's so many variables in our lives that can go wrong. And so one of the things that like this research then enables is to get a better understanding in an anonymized way, through blockchain technology, is to better understand, okay, if there's a certain drug that on the market that's not performing as it should be, what are the reasons? Is it logistics? Is it the medication itself? Is it whatever it might be, right? So research in that form also. But now to like be a little bit more specific around the diabetes use case. So I'm going to get a little bit scientific here, but dear audience, just bear with me here, and we'll try to take it into smaller steps. So the first thing to realize is that there's two types of diabetes. Type 1 diabetes essentially occurs occurs in the human body when the pancreas isn't able to produce enough insulin, and hence has a very wild effect on the blood glucose levels. Blood glucose levels in our body are very instrumental in the way we function. So glucose is one of the most important energy deliverers in our body. So if we don't have enough glucose, we feel tired, and when they drop in a very low in a very low range, then it has effects like we might faint, and it could even end fatal. If it goes too high on the other side, like it's the same effect, right? So being able to control the blood glucose level in a specific range is very important. And anyone who is healthy, our body is an amazing system and organism, because our pancreas actually does that for us. So essentially, it's a biological closed feedback loop where the body realizes, okay, this is how much glucose I have, hence I'm gonna have my pancreas exert a certain amount of insulin and kind of close the loop on that. In type 1 diabetics, this is not the case. And so current state of the art technology actually, the first step would be, okay, you prick your finger to measure what is my blood glucose level, and then I take a needle and first I calculate how much insulin I need, and then I take a needle and insert that into my body manually. The second more sophisticated mechanism after that, or on top of that, would be, okay, now I have a CGM, so a continuous glucose monitor. that continuously reads what is my blood glucose level, so I have a better understanding. And this changes all the time, whether it's going out for a walk, doing exercise, doing yoga, being in a more peaceful environment versus being out like in a stressful crowd. How did I sleep the evening before? Am I drinking alcohol? All of these different components that have an effect on the blood glucose level. And then the third iteration after that essentially is, okay, now let's not only measure our blood glucose level continuously, but at the same time also build a closed feedback loop, essentially mimicking the natural pancreas system, in which an algorithm calculates how much insulin is required and then is connected to an insulin pump that then directly pumps the insulin into the body. So now we have this closed loop system that looks at, okay, what is the current blood glucose level? How quickly is it rising or falling? And then I can insert, automatically the corresponding insulin level. Mm-hmm. But, I mean, this sounds good, and it is good, but the problem is people with type 1 diabetes. Exactly. And here the problem is that people living with type 1 diabetes are dependent on the system, and they cannot just turn off their brain because they continuously have to worry about, okay, am I going to be in range? Is my blood glucose, is the insulin going to pump, going to do exactly what it's supposed to, and am I going to stay in range? Because, like I said, it's a very sophisticated system, very complex, many variables, whether I'm sleepy or I'm hydrated or I'm drinking alcohol or whatever it might be. There's so many different factors that it's a continuous mental strain. And it requires a lot of logistics. Like, for example, if I'm going on a trip, I have all of these different things to think about, like in my all of the equipment and medication that I'm taking. So, getting to the point, what we're doing and how this relates to Welshare. So, there are current first initial efforts on using AI to enhance these systems. So this closed loop system, it's called AID, which stands for Automated Insulin Delivery. And essentially what AI can do now is look at other data and other variables. So not only am I going to look at what is my current blood sugar level and is it increasing or decreasing and how fast is it increasing or decreasing, but now I can look at a bunch of other data. For example, sleep data. So what if I connect my Oura Ring or my Whoop Band and look at, okay, how has my sleep recovery been last night? How much energy do I have? How's my body going to react to the insulin dosage that I'm about to give it? Or nutritional data, for example, like am I going to have a carb-heavy pasta or lasagna for lunch, or am I just having salad? So all of these factors play different roles, and the way this ties into Welshare is we see ourselves as a platform that allows you to aggregate that data and to be able to share it with these research organizations, so that when for example Abbott or any other medtech company is looking to enhance these AID systems with better algorithms and particularly AI systems, there is actually a method and a platform that allows them to get to that data. So yeah, that was maybe a bit too scientific and too nerdy, but
No,
hopefully
I
that
think
was,
that was interesting, man.
yeah.
Honestly, I love how you tapped into, that there's no one solution fits all, so one algorithm fits all, right? Because that's how all these insulin pumps, to my understanding, work, But you have so many outside factors, I wear a hoop myself, and I sometimes see very weird correlations, right? Cold showers, sauna, coffee at 4 p.m. versus coffee at 1 p.m. Right?
Yeah.
There's so many correlations. Some of them are small, but there's things that actually impact you much more than 1% worse sleep, right? In my case, just as an example to illustrate, was actually if I took a magnesium before going to sleep, my sleep was basically fucked. And I don't know if that was some substance that came with the magnesium or magnesium itself, but most of the people, they react positively. After magnesium, you recover better, you sleep better. In my case, it's been ruining my sleep for several months. and I figured out thanks to Hope, and I cannot imagine, how this data actually can help gain insights to people that have certain diseases that they need to care more about just getting a good night of sleep, right?
That's right. Yeah.
But thank you for using this use case on the diabetes research. I think that's a very important problem to tackle. And there's actually a lot of people with diabetes in the world. But I'm just wondering, this is the starting point, right? This is where you guys try to validate the concept you have, the product, where you try to onboard users, and kind of prove that this work, there's market for it, and you can solve certain problems. But how do you actually plan to expand into like other therapeutic areas, into other diseases, perhaps the ones that are less common? What's the game plan there?
Yeah, good question. So that's right. So diabetes is our initial focus point. The long-term vision is to be therapeutic agnostic and to essentially be able to provide this tech stack and this platform to any researcher who's interested in a particular use case and is hence able to find that audience of individual users to provide that kind of data. As it pertains to the question of like how to actually expand, I think it's important to see that this initial use case, as you rightly said, is going to help us validate a lot of our initial assumptions. So what we're doing is we're building as much as we can bottom up together with the community. So in diabetes, we're working with various patient communities and advocacy groups. Actually, two of our advisors are leaders of such advocacy groups, and just doing co-creation workshops together with them. So being able to really fully understand their points and their needs and what it is that they're looking for if they were to use such an app. And I think from a tech perspective, there's obviously a lot of things that will be almost instantaneous. So any data that is relevant, so I'll just take a couple examples, but like any data that is relevant that I can measure with my CGM might also be relevant for the longevity space, right? Or for example, for heart and kidney diseases, because there's a lot of biological complexities that concur together with the blood sugar levels. So I think branching out into therapeutic areas that are in near proximity to diabetes next makes a lot of sense to take those, not only the learnings from actually building the system, talking to the different patient communities and so on, but also just leveraging the existing tech stack and the data that's available. But also just taking learnings as it pertains to just from an operational perspective, like how do we work with these large Web2 organizations who are not accustomed to the quick and agile DeSci methodologies, right? So I think a lot of that also is going to be a learning curve. I mean, for us, but obviously for the entire DeSci space. And I think it's great. And I'll show Data Lake here a little bit maybe, but I think it's great that you guys have already these existing partnerships with large pharma companies, because it just goes to show that not only is there a need for these use cases, but also kind of working together of these two very different working styles, like a small agile startup in the DeSci space that maybe has
I thought you're gonna say
different working styles.
I thought you're gonna say that blending these two working styles, cat and dogs memes versus these serious worldwide organizations, right?
Exactly. Yeah. So bridging that gap, I think obviously is key. So being able to learn how to deal with that, and also being able to, I think a large component, and we kind of touched on this earlier also, is just like education and awareness. So I remember back in my pharma days, when I was starting to talk about this, like a lot of the times, like one of the initial questions was like, oh, is that crypto? Isn't that corrupt? And so just like there's crypto and Web3 in general, I guess, just like has a lot of misconceptions, I'd say. People looked at NFTs as these ridiculous monkey JPEGs, and me personally, I also agree. There's some definitely some validity to that aspect of it, right? But I think when it comes to education and awareness, it's really like it's part of our jobs here as the DeSci community to really be able to, in very easy terms and non-Web3 terms, be able to explain how Web3 works and why it's so beneficial to work in decentralized ways. But yeah, I just personal anecdote. It's just interesting to see people's reflections and probably mostly also misconceptions about the space, which obviously need to be addressed before you can build any long-term relationship. But yeah, it's great.
It's great, and it's crazy at the same time. I have also a lot of stories, of convincing the partners we have, right? I mean, it hasn't all been sunshines. It seems great at the paper at the end of the day, but it's a lot of work, and it's a lot of work that we're doing actually collectively as the space, to build it some sort of a reputation, right? That we're doing something useful. I have a question. I mean, obviously I have a question, but this one's quite interesting because we've already tapped into some of the challenges of implementing decentralized stuff in the traditional healthcare. But what do you foresee would be the biggest challenges, not only for you, but for DeSci in the upcoming years to kind of blend in with the traditional healthcare and the traditional tech that's used in healthcare?
Yeah, that's a good question. So I think there's many things that need to align, and I think maybe which brings me maybe to the first point, which is aligning expectations in terms of timeline, right, with these two different groups. So anyone who's not familiar with the healthcare system, I understand it's hard to grasp that timelines are just tremendously long, right? It takes multiple years, on average around 10 years to develop a drug. So the healthcare space, obviously for very good reasons, is regulated stringently. Right? There's certain aspects of it which are probably overregulated to certain degrees. I've had this experience in digital health where a lot of the things that we were doing in digital health had to be done the pharma kind of way, even though we weren't actually creating a medication. So I think the first component is really understanding that there's different time horizons here. And I think in Web3, it's a very, very fast-paced environment. And I think it's important for people to understand that anyone who has expectations of, changing the world tomorrow, like maybe you're in it for the wrong reasons. So so I think that would be one thing. But I think there's a lot of other things. I think education, like I said, is a huge component. I think when we talk to pharma companies and medtech companies, one thing we observe is that they tend to kind of think in these silos, and also in this notion of why would we do something, like why would we change, like if it's already working, we've been doing this for, like I was saying earlier, like decades, like why would we change? But this is also the same reason why there's not been disruptive change in healthcare, at least not to the same degree as there's in other spaces. So I think a lot of it is, and I was reflecting this actually when I was leaving my job in pharma, was that like a lot of it is just cultural change. And I saw it at Sanofi where, you can see like the news outlets on like how much emphasis they're putting on AI. Like this is a company that I personally feel is actually going to make it, right? If we're using Web3 terminology, like I think they're going to make it because they understand that there is the need for constant change, and the moment you feel like you're at that peak of, things are going well and you feel comfortable, that's really the moment where you should challenge yourself and disrupt yourself, right? Because if you don't disrupt yourself, then someone's going to come from the outside. You're going to be blindsided. You're not going to see it at all. yeah, I'm very confident in some of those teams that I personally worked with, and some others that we're currently talking to. I'm very excited about those. There's definitely going to be companies that are going to be a lot slower. It's also just interesting talking to them, but I think that's just the nature of the game, and the way like macroeconomics works out. Like if it's
That's
if
every
one
industry.
company,
Every industry,
exactly, every industry.
it's the same with AI, right? So
Yeah,
ChatGPT goes out, someone builds something better than them, and then there's Apple, They come and they say that they're 2 years late, and they don't care, They just want
yeah,
to be in the game.
yeah, yeah. Yeah, but like I mean, just to summarize it, I think there's also many other points, but I think to summarize it is, um, what are the things that we're gonna have to see? I think it makes sense to see as many tangible use cases as possible. So I mean, like all of the DeSci projects have slightly different use cases, but I think the ethos is the same, which is using the power of decentralization to really progress research, science, healthcare, whatever like that particular problem is that they're solving, but just like actually build things. And in my opinion, the initial product doesn't even need to be like the fanciest thing that anyone has ever seen, but it needs to work. It needs to be able to prove that initial point, and then you work from there, iterate, and build out the product and build out features that people actually want. So yeah, I mean, and also like because you were asking about DeSci, like there's different layers to DeSci. So I think as it pertains to research, because research by nature just is a longer term thing, that's just going to take a little bit longer for us to see, the first actual use cases being successful. So I think a lot of what like the BioDAOs, for example, are doing is absolutely great. And I think the larger institutional players, the pharma companies of this world are gonna start paying a lot. They already are paying attention, but I think they're gonna start paying a lot more attention. And my prediction is going to be a lot more hands-on the moment they see an actual drug being produced that way. And I know they're working on a lot of great things. There's been spin-outs to actual biotech companies. So I think the DeSci space as a whole is really on the right path. It's just a matter of time for things to show their successes.
Yeah, I mean, it's gonna be a matter of time, and I wouldn't be surprised, if DeSci is gonna go so fast that it might actually be faster in building and finding stuff than some traditional bio companies, right? At the end of the day,
For sure, yeah, for sure.
with the power of the community and the funding, there are things that's well, sky's the limit, right? That's what they say. But talking about DeSci, decentralizing stuff, everyone has a different definition of that. There are people in the space trying to get to the moon in a decentralized way, trying to do space research, someone wants to do maritime protection, there's a lot of interesting projects. But everyone has a slightly different vision about what does it mean, decentralized science. Or what does it mean to build under this, kind of lately hot trend, right? The narrative. But well, that's my question, right? What is DeSci for you? What is its meaning to you?
That's a good question. I think it's important that people have different opinions about what DeSci is. I think that's a very, very good sign, because it shows that not only do people care, but there's actually enough diversity. There's enough volume of people that there's enough diversity for there to be different opinions. I think if we all completely agreed on what needs to be done, there wouldn't be enough volume and diversity to actually progress that in different directions. So we sometimes talk about like I'm going to put this in like quotation marks, but like the DeSci drama that goes on every once in a while, when people disagree. But I think that's something very healthy for the space, because I think one of the ethos components of Web3 is building with the community and by the community. So in a decentralized way, right? So we don't want there to be a single entity or a single group of people who predefine what it should be and what it should not be. But I think it makes the most sense to just have the community decide. Everyone should be able to vote in that regard and have their own opinion. So, but that's the preface. For me, what does DeSci mean for me? I think there's a lot of different components to it, but the general answer would be essentially using blockchain technologies and decentralized tech to solve real world problems in the science fields. And like you said, I mean, I personally am very passionate about the healthcare space, so I continuously talking about the healthcare space, but you're absolutely right. There's people going to the moon and people dealing with maritime issues. So it has a lot of different applications, but it's really the use of these blockchain technologies to solve a specific scientific problem. And then the more nuanced answer, I think for me, where feel free everyone else to agree or disagree with me, or have your own definition. But for me, one of the most important aspects to DeSci really is around healthcare. And obviously, like I said, that's a very, very biased reply, but I think it is a very important component because the current healthcare system is just so messed up. There's so many misaligned incentives between the different stakeholders. When you think about healthcare companies and like insurance companies, for example, right, have very different incentives that might not be in the best interest of the patient, or pharma companies, or even if we're proponents of doctors, every doctor also has incentives that might be not aligned necessarily with the patient. That why do we only get to spend 5 to 10 minutes on average with the patient, right? So there's a lot of, and I'm not saying this is the doctor's fault. I'm just saying like the system that currently exists has so many misaligned incentives that need to be fixed. And I do think that leveraging the power of decentralized tech is really going to help us go in the right direction to fix that.
I'm biased too, like when it comes to healthcare, But I think it all starts with us, when all of us are gonna be eventually patients, right? And most of us have already been in their life, and it's something that we will encounter, and something that is gonna kind of carry through our lives. So my personal opinion, healthcare is very important, the same as biotech and everything that's close to the human body. And I love how you tapped into the system being broken. I've seen this tweet a few days ago, right? There's like, science, yeah, you can do research on anything. Researcher treats cancer, the traditional science. Oh no, you cannot do that, right? So there's a lot of stuff broken, and I think that DeSci has been addressing it very well. And when it comes to to the dispute of the opinions, community should decide. And I think DeSci is about when you disagree and want to do it differently, then you should have the option to go and just simply do it. And that's basically I think the ethos we all believe in, as you have mentioned. All right, Jock, time is slowly running short, but I want to quickly, before we end, tap into a little bit of shilling stuff, a little bit of, more about the Welshare and about some alpha that you perhaps might have to share with us. If not, nevertheless, I think all of the people listening to us live or from the recording on Spotify or Apple Podcast might be interested in what is the future development that we can actually expect from Welshare. What's the next big thing, what's coming, what we should be looking for and expecting from you guys.
Yeah. There's we have a lot of exciting things coming up. Of course, many of the things that are currently under development I can't disclose yet. But I think the one obvious thing that's also in the near term that I've seen people already be very passionate about is we currently are opening up, I think I mentioned it earlier a bit, we currently opened up whitelist registration applications for the second iteration of our closed beta. So anyone who's interested in getting early access to the app, being able to see what the app looks like, start using it, start testing it, giving us valuable feedback on it, of course. But of course also to be able to start earning the in-app reward points, the sherries. We'll be opening up that in the very near future. So applications are currently open. So yeah, like I said, if you're interested, you can check that out. I'm not going to say too much here because yeah, there's definitely a lot of fun things going on. And to be honest, I think I'm very excited for next year. We just, my co-founder and I, we just recently realigned on some of the things that we kind of put on pause as we were, preparing for the token launch, because anyone who's launched a token knows how much work really goes on behind the scenes. So obviously that like took a lot of time, but now that the token is launched, I think we can focus on actually building some really, really cool stuff. So
I'm gonna stop you there because I just want to express congratulations towards the launch you guys did, because I believe that that was a great example of how you do actually a token launch. And I've actually spoke to some people on DevCon here, and they actually mentioned the Welshare Health token launch a few weeks ago. So big congrats. And
yeah, thank you.
as I'm hearing around, it's been a success. So hopefully you can confirm that.
Thank you. Yeah. I mean, like I said, it's a lot of work behind the scenes that goes on. But really, the most important factor, let's be real here, is the community. So, I mean, I think the DeSci community as a whole is just so passionate, and everyone is just so interested, right? So, I think it's really about the community, and so I just for all you listeners out there, thank you for supporting, for being so interested, for building in DeSci yourself, you including Oliver, by the way. So yeah, just very, very excited to be working. I think I tweeted this out recently. It's like I'm just super excited to be building something that I love, and to be surrounded by people who also love what they're building and working together on that. So I'm just very, very fortunate right now. I'm very grateful to be able to do that.
Yeah, welcome to DeSci, welcome to Web3, and I think that we both share the same feelings about that, and I'm really excited about what's coming on the Welshare roadmap, the same on the data lake roadmap. A lot of exciting stuff that we also cannot disclose, but I have a feeling that the upcoming months are gonna be very, very interesting in this field.
I think
All
so
right.
too.
I think we have time for some closing notes. So from my side, it's gonna be a huge thank you for everyone who's tuning into this episode. Go check out definitely Welshare Health, the Welshare token, and all they do. I'm also gonna real quick share our newest collaboration with Mudu. Go check that article. Largest epigenetics and wellness diagnosis labs in the UK. I actually have a DNA test kit here on the desk that I got as a promo. But this also boils down all into the interesting fact of how these traditional web 2 companies wanna start building in DeSci, either by investing or either by building their own product there, or just decentralizing in a way that helps grow the space. So thank you, York. Thanks everyone for tuning in, and I'll leave the closing thoughts to you.
Thank you for having me again. Congrats on the partnership. I think that's great. That's exactly what we went through, is specific use cases and milestones on how to make things more tangible in the DeSci space. And also, again, thank you for hosting these podcasts. I think it's great for creating awareness around the space and really pinpointing down some of the very specific projects and use cases that people are working on. So yeah, just very, very grateful. Very, very grateful. Thank you for having me.
Amazing. Guys, please like, subscribe, follow Welshare Health, follow Data Lake Token, and also Biohacker DAO, because without these free projects we wouldn't be able to bring today's episode, 7th episode of DeSci Pulse. And we'll be more than glad to host you with another episode, all the listeners there, next week, again on Tuesday. And I'll see you there next time, already together with MGos from Biohacker DAO. See you in the next episode, everyone, and have a great rest of the week.